con los terroristas.
Shaking. Fun for some, a daily struggle for others. Now, what exactly do I mean by that? Well, to answer that question, let's start with Eric Roos, the man who was shaking in the video. Due to the fact that he was actually shaking like the song Harlem Shake instructs us to, you probably think there was nothing wrong with him. But indeed, there is something wrong with him. Eric has Parkinson's disease, also known as shaking palsy, paralysis agitans, or Parkinsonism. What is Parkinson's disease? Is probably what you're wondering right now. Well, here's the answer. Parkinson's disease is a disorder of the central nervous system that causes various parts of the brain to lose cells. Parkinson's disease is chronic and progressive. In other words, it doesn't leave the body and it gets worse. It is the fourth most common neurodegenerative disorder. There's a part of the brain called substantia nigra, which, like any other part of the brain, is full of neurons, also called nerve cells. When there's any impairment or distortion problems with these neurons, it results in a loss of dopamine production in the brain. Dopamine is something referred to as a chemical messenger in the brain that helps the transmission process of signals in the brain and other very important areas. Without enough dopamine, the neurons that control the body's movement don't function correctly. With that, the body's movements doesn't function correctly either. This is what is happening inside your body during Parkinson's disease. Parkinson's disease was discovered by an Englishman who went by the name of Dr. James Parkinson, hence the name of the disease. There aren't too many stories behind how he found Parkinson's disease, but there are many biographies that describe the man as a pioneer of medicine who studied at the London Hospital Medical College and qualified as a professional surgeon at the age of 29 in 1784. There are many problems involved in Parkinson's disease, but one of the main ones is the fact that no one knows what causes Parkinson's disease. To elaborate more on the topic, I interviewed 13-year-old Dr. Alyssa Watkins. Hello, Dr. Alyssa. How are you today?
I'm fine, Ariana. How are you?
I'm good. But can you elaborate more on the issue of Parkinson's disease not having a known cause?
Oh, of course I can elaborate that for you. So, as you know, there's no known cause for Parkinson's disease. We tend to infer that as an idiopathic.
What does idiopathic mean exactly?
It really means rising spontaneously. It just comes out of nowhere. Although we're not sure what the cause is, we do have an idea of what factors play in the role of it.
What are these factors exactly?
The factors are your environment. Exposures to toxins such as magnesium and herbicides and pesticides can increase your risk of getting Parkinson's. Then there's the age factor. The older you get, the higher the risk you have in a Parkinson's.
About how old do you have to be to have Parkinson's?
Well, the average age to get Parkinson's is 60 years old. But there have been lots of reports of people as young as 18 getting it. Last, there's heredity. It seems that when there's a close relative in the family that has Parkinson's, you have a risk of getting the disease. But there's no need to worry. The risk is really low unless there's lots of relatives with Parkinson's.
Alright, so I have to ask, who gets the disease more often, girls or boys?
Luckily for girls, men have a higher risk. But girls do have a very slim chance of getting it too.
Dr. Alyssa then went on to tell me how you find out a person has Parkinson's disease. For starters, there's a number of symptoms which include problems with memory, having a hard time thinking or focusing on anything, moments where the body stiffens or you have immobility, depression, having problems with speaking or swallowing food or water, and absolute loss over your body. Due to the fact that no one knows what exactly causes Parkinson's, there's no actual diagnosis for it. but there are neurological and physical examinations that people can be given. When checking to see if you have Parkinson's, doctors are sure to check all symptoms you may have and your medical history. One more thing that is done is that doctors give patients medicines called carbidopa and levodopa. This helps determine if the patient has Parkinson's, because if the symptoms improve automatically, then there is a chance that person has Parkinson's disease. I then interviewed 9-year-old Dr. Asia Watkins about treatments for Parkinson's.
So Dr. Asia, are there any treatments for Parkinson's disease?
Of course, there's no cure to Parkinson's disease, but actually there's quite a few treatments. There's a levodopa. This is the most effective medicine we have. It's chemicals that go through our brain that converts into dopamine. You should know by now, dopamine is what helps our bodies function.
Dr. Asia then went on to tell me about a number of other treatments that are helpful for people with Parkinson's. There's dopamine agonists. It's like carbidopa, levodopa, but the difference is that the medicine doesn't convert into dopamine. It just simply copies the effects that dopamine gives the body. A surgical procedure that is helpful is referred to as deep brain stimulation. This is when surgeons implant electrodes in a specific part of the brain, and the electrodes send electrical pulses to the brain. This procedure just so happens to improve the symptoms of Parkinson's disease. There are many other treatments, but one that you could probably find in the store is Nuapro. It is full of retigotine, which is almost like dopamine agonist. People who have to suffer from Parkinson's disease have to face many complications in life. These complications are very similar to the symptoms of Parkinson's and can range from having trouble thinking to having bladder problems, such as not being able to urinate and urinating all the time. The main complication is having little to no control over your body and movements. This is what we see in most people with Parkinson's disease. People have troubles doing simple tasks that we can do without having to think twice, like sleeping, drinking, or writing their own name.
Parkinson's affects everybody differently, and that's the randomness of it, and I can't predict how I am each day. It's not just a tremor and it's not just stiffness. It affects every muscle in your body, to your fingers, to your throat muscles. But to have to deal with people's looks at you and presumptions, sometimes people get impatient, sometimes I'm a bit off my feet. I nearly fell over the other week, and they just think, she had a few too many last night, or has she had some this morning?
People think that Parkinson's, because it's called Parkinson's disease, that you can catch it. I actually humoured this with a guy once. He says, "How did you get it?" And I just was in a mood, so I said, "I stroked a stray dog." Probably shouldn't have done that. You can still have a relationship. I've got my 8-month-old son, and that wasn't a one-off. Some days when my medication's working fine, I can be seen to be completely normal. One of the bizarre things with me is that I've found when I can't walk, I can run. I'm sure if you did a survey with the people that come into the park and said, "Do you think that girl over there's got Parkinson's?" they would all say no.
Now, for those of you who are currently watching and don't have Parkinson's disease but have a fear of getting it, there's no need to worry. There are a couple of ways of preventing Parkinson's. For starters, caffeine is a great fighter against Parkinson's. In order to get your daily dose of caffeine, drink some green tea and coffee. And if you don't prefer those drinks, then there's always soda that you can drink. Nicotine also prevents Parkinson's disease. I'm sure the first thing that came to your mind was smoking tobacco. That indeed is a great way to prevent Parkinson's disease. But another healthier option is to eat veggies full of nicotine, such as eggplant, potatoes, and tomatoes. The last way you can get your quick fix of nicotine is by getting a nicotine patch, where you can get from either the store or from your doctor. 20 years from now, I see there possibly being a cure for Parkinson's disease. Yes, it is true that no human on earth knows the cause of Parkinson's, but many researchers, scientists, surgeons, and medical students are still looking for it every day. There have actually been reports that a mutation has been found in the LRRK2 gene, and that the mutation is usually found in people who have Parkinson's. There's much research being done to find how this mutation is created. There are also reports of something called alpha-synuclein found in the brain. No one knows what its purpose is in the brain, but researchers strongly feel that it plays a role in Parkinson's. A vaccine has been created that gets rid of it. The vaccine has been placed in only a few clinics so far. The Michael J. Fox Foundation is supporting the vaccine at the moment. Just last January 2012, the foundation invested $47 million into the vaccine. I feel that with foundations like the Michael J. Fox Foundation and the Shake It Up Foundation around, the cure for Parkinson's disease will be discovered in 20 years. Top.